Dental implants are considered an investment because they improve your overall quality of life. You think about defining investment, it's an asset that builds value. Yes, there's a cost to dentures and implants, but the benefits go beyond the monetary. We see our patients build confidence in their smile. They're able to enjoy their life. They're able to be in the moment and be present for their family. They become social. They enjoy going to events with friends. With the dentures and implants, a lot of our patients, when they come back, they're living a normal life. They're not dealing with something that's removable like a traditional denture. They're not limited in their daily activities. They're living their life to their fullest, meaning that they are able to exercise. We have people who have, autoimmune diseases or diabetic, and they have to follow a strict diet. When people have dentures, they're limited to soft foods, which are not always the healthiest. The mouth is the gateway to our health, and a lot of that is because of the diets we're able to eat or the food we're able to enjoy. Some of the questions to ask when considering dentures and implants are, what technology does that office have? Are they able to plan everything before the surgery? Is the smile going to be custom to the patient? If the doctor has a good lab or a good rapport with the lab, things are going to meet the timelines as described. When there's a lab that's inefficient, there's items or the prosthesis doesn't fit right the first time. It creates a lot of repeat appointments. With the technology that I have the control to plan the case from the start and see it through to the finish. We often get patients that are asking if we're an oral surgeon or if we're a periodontist. And one of the things that I try to stress to them is that I'm trained in implantology, I'm trained in reading CBCTs, and I know how to plan cases digitally. When patients talk about their past experiences with implants, they usually have to go to a different office to have the implant placed. And then they come back to the general dentist to place a crown. And in my experience, there's a loss of information when patients have to go somewhere else. It's important for the team to be trained in the process. When our front desk schedules a consult, they know that we need to take photography and capture a 3D scan. So when the team is aware of the steps, everyone's on the same page, and the surgery will be successful. As a patient, we have anxiety towards the doctor. Because my team knows the procedure inside and out, when I step out, they confide in my team, and they ask questions that they weren't comfortable asking me. And so it's important for my team to be on the same page because we want to give them the same answer. For us, it's another implant, it's another routine procedure. It's the patient's first implant, it's the patient's first crown. We stress that implants need routine maintenance. Some of our patients believe or have the misconceptions that once their teeth are removed and they receive their implants, that they do not need follow-up appointments, that they don't need to see a dentist every 6 months. And to that we stress that it's very important to have follow-up care and to get x-rays on a yearly basis, ensuring that the implant is healthy and that there is no bone loss. To make dentures and implants more affordable, we do work with third-party lenders that work with our patients to set up a payment plan that's reasonable. Our patients are able to get out of pain immediately and achieve a new smile faster. At Legacy Smiles, our motivation is to understand your goals and create a plan that fits within your budget.